Chapter 57. Frostbite. Call your vet the same day. Ice cubes often overflow their trays because water expands as it freezes. The same thing happens when dogs and cats get frostbite. Water in the body's cells freezes and expands, causing cells to rupture. Frostbite usually occurs in the extremities, such as the ear tips, tail, and toes, because the body responds to extreme cold by diverting blood into the torso. Parts away from the center of the body get less blood, which causes them to freeze more easily. Frostbite can be hard to recognize because the characteristic pale white, gray, or blue color of frozen skin may be invisible beneath the pet's fur. Pets with frostbitten toes will limp, and frozen ear tips will often droop. The affected skin will be hard and non-pliable, and it will be extremely cold. Days afterwards, there may be redness, blisters, and possibly a serious infection. All cases of frostbite should be seen by a veterinarian immediately after first aid at home. Medicine chest. You'll need a rectal thermometer, petroleum jelly, lukewarm water, cloth, antibiotic ointment like Neosporin, or protective ointment like Desitin, Elizabethan collar, plastic wrap like Saran wrap, a bread wrapper, or garbage bag, tape, and a pill syringe. Do this now. Check your pet's temperature. First, take her inside right away. Pets with frostbite often have hypothermia as well, so use a rectal thermometer lubricated with petroleum jelly to take her temperature. If her temperature is below 99 degrees Fahrenheit, begin treatment for hypothermia right away. Refer to the chapter on hypothermia. Thaw the frostbitten areas. Try to thaw the affected areas by dunking them in lukewarm water for about 20 minutes. Small areas of skin that are not deeply frozen are often very red immediately after rewarming. The skin will become softer, warmer, and more pliable. One dunking should be enough, so repeat only if necessary. Dunking isn't easy when the frostbite has occurred on the ear tips or scrotum. You can warm these areas by wetting a cloth or a paper towel with lukewarm water, leaving it dripping wet, and holding it against the affected skin for 20 minutes. Don't rub the area, just hold the towel gently against the skin. Exchange the cloth for a fresh, warm one every couple of minutes. Use this procedure to warm any affected area if your pet has hypothermia in addition to frostbite. Since water evaporation removes heat, you don't want him to get too wet. Put the wet cloth only on the frostbitten areas. Follow-up care. For mild frostbite, your veterinarian may advise you to apply an antibiotic ointment like Neosporin, or he may recommend using a protective ointment containing zinc like Desitin, which can help skin damage heal more quickly. Follow your vet's instructions for application. Dogs and cats with sore skin will often lick it so much that healing is very slow. Your veterinarian may recommend using an Elizabethan collar, a cone-shaped collar that fits around the neck and face and stops pets from licking. Be sure to remove it during feedings. Veterinarians usually apply bandages to areas with serious frostbite. You'll need to keep them dry to prevent further skin damage or infections. You can protect the bandages on your pet's legs by wrapping them with plastic wrap like Saran wrap or a bread wrapper or garbage bag and taping the plastic in place. Use the wrapping only when your pet goes outside. Inside, removing the plastic will allow the bandages to breathe. Check with your vet for instructions on how often the bandages should be changed. Your pet may need prescription antibiotics when he comes home. Follow your veterinarian's instructions for dosage. For dogs, you can hide pills in a hunk of cheese or other treat. Cats may not be fooled as easily, though, so use a pill syringe and give your cat a treat afterward as a reward. Advisors include veterinarians Shane Bateman and Sandra Sawchuk.